heard at like 102 or 104 and above, you take them right into the emergency room. Is that not true?
No, that is not true, because fevers are very, very common. They're mostly happening with a virus, and viruses are not dangerous. They go away on their own. And so you don't need to take your kid to an ER for the vast majority of fevers. There's a couple reasons to take your kid to the ER, and that would be, number one is if they are under 3 months old, any fever of 100.4 or more, we do want them to be seen right away, either at the doctor's office or in the emergency room. Another thing is if a child has had a fever for more than 5 days, then we kind of allow them with a virus to go up to 5 days, but after that you would want them to get them seen. Or, I mean, if the fever is going over 104 and staying over 104, then you want to get them seen, but it's still not like a rush to the emergency room. The main thing with a fever is how somebody looks when they have it. Most people, if they especially get a higher fever, they don't feel good with that, including kids. They might be more out of it, or they might be crying more. And so if they're getting that way, you could go ahead and treat them with a fever medication like Ibuprofen or Acetaminophen to just help bring the fever down and just help your child be more comfortable, but also to make sure that when you bring the fever down that they're acting more like themselves, playing a little bit or eating a little bit, something like that. If they're doing that and the kid looks fine, either before the medication or after the medication, then you're okay just to monitor them, see, depending on the other symptoms, see if you want to take them the next day to the doctor. But as long as they look good, you really don't need to be rushing to the emergency room. And also another reason why you might want to take your child into the doctor, though, is if they're getting a fever after they've already had an illness for a few days. So for instance, with most viruses that have fever, the fever starts around the same time as the other symptoms. So like within the first day or two of a cough, runny nose, if someone's they probably get the fever at that point if they're gonna get one. But if the child has had, for instance, a cough and runny nose for a few days, and then they get a fever, we would wanna be seeing them. You wouldn't wanna wait 5 days for that fever. You'd wanna take the child to the doctor. It doesn't have to be the emergency room, but take the child to the doctor just to make sure that there's no, not like a secondary infection, like an ear infection or pneumonia, something like that. Mostly, in order to treat a fever, you're mostly just treating the child for their comfort. Another thing about treating it that sometimes I think people think when they give them a fever medication that it's supposed to bring the temperature down to normal. It often doesn't do that. It might only bring the temperature down by 1 or 2 degrees, and that's fine. Because, like I said, the fever itself is not the issue. It's sort of what's underlying the fever. And the vast majority of the time, that's going to be a virus that's going to go away on its own.
I feel a lot better now about fevers.
Good.
They make it sound like such a big deal.
Right. Yeah, people get worried.
It's good to know it's a good thing. So that was Dr. Wagner talking about fevers. Next time, we are going to talk about colds and learn a little bit more about keeping our kids healthy and safe at school.
Antibiotics don't help a cold. So because colds are caused by a virus and antibiotics treat bacteria.